So once again you are welcome to Angel Health Academy. Subject Community Health Nursing. Topic for the day is School Health Services or School Health Program. School health is an important branch of community health. So it is an important branch of the community health. School health services is a personal health services. It is a personal health service. And it is an economical and powerful means or tools for raising the community health. An economical and powerful means or tools for raising community health. Next is historical development of school health services or program in India. In 1909, the first medical examination for the school children were done in Baroda city. Then later in 1946, Bhore Committee given report in that they were mentioned the school health program or services in India were underdeveloped. So underdeveloped school health services. Then later in 1953, the Secondary Education Committee emphasized the need for school health services and school nutrition program. Then in 1960, Government of India constituted School Health Committee. Then later in 1961, School Health Committee were given report with certain recommendations to improve the health of the school children. Next is definition of school health. According to Gulani, school health refers to a state of complete physical, mental, spiritual well-being and not merely the absence of disease or infirmity among pupil, teachers and other health personnel. So according to Gulani, school health refers to the state of complete physical, mental, spiritual well-being and not merely the absence of disease or infirmity. Infirmity means disability or weakness among pupil. Pupil means school children, scholar. Then teachers and other health personnel who are working at school. Next is the definition of school health services or school health program. So school health services or program refers to need-based comprehensive services. It is a need-based comprehensive services rendered to pupil. Pupil means school children, teachers and other personnel in the school to promote and protect their health, prevent and control the diseases and maintain their health. According to Gulani, school health services or school health program refers to the need-based comprehensive services. So school health services is based on the need of the school children. So it is a need-based comprehensive services rendered to the pupils, teachers and other personnel who are working in the school to promote their health and protect their health, then prevent and control the diseases among the pupil, teachers and other personnel in the school and maintain their health. Next is nature and scope of school health services. The first scope is, it is an integral part of the community health. School health program is the integral part of the community health. It is an inevitable part. The second scope is, it can be a powerful influence or tool for shaping the health behavior of the school children. Because school children we consider they are the pillar of the nation. They are the pillar of the nation for tomorrow. The third scope is school health services is a personal health services. Let us discuss in detail about the nature and scope of the school health services. First point is, it is an integral part of the community health. Thus, the school health services is the face of community health and family health services. It is one of the face of the community health and family health services which promote the well-being of the children and their education. It promotes the education of the school children for the healthy living in the future. The second scope is, it can be a powerful influence for shaping the health behavior of the school children. In school health services, there is a unique opportunity to promote, maintain and improve the health and well-being of the school children, since teacher reach most people early in their life, where the attitudes and values are most readily developed. So the teacher can modify the attitude and values of the school children in the earlier life as she reach most school children in this period. The third scope is, school health services is a personal health services. It stresses the role of a child as a change agent for the community. A child has a greater capacity to observe, learn, experiment and then transfer this knowledge to the other people. maybe to their families or to their relatives, their neighbors, etc. So school health services stresses the role of the child as a change agent for the community. Indirectly, they are the health personnel. They communicate the knowledge what they grab in the school to the neighbors, to the relatives and to their family members. Next is need or importance of school health services. There are 8 different needs or importance of school health services. First one is vital or substantial segment of the population. School children are the vital or important substantial segment of the population. As we consider, they are the pillar of the nation tomorrow. So they are very vital and they are substantial segment. Second need or importance of school health services is they are the large population. They form nearly 30% of the total population or 1/4 of the total population. So the school children are the large population. So that is the need and importance for school health services. Then third point is it is a period of growth and development. So the 5 to 14 year is the period of growth and development. So they need special attention and special focus in their health. Then fourth point is they are group living or group life. As they are in group living, they are prone to have more diseases and they are able to spread the diseases from one community to other community as they are belongs to different communities. So they are group living and group life. Then fifth point is they are the controlled population and there is a possibility for easy implementation of the health services or health awareness to the school children, because they are under the control of the school committee. Then early detection is possible. As the teacher observes the students every day in the morning, there is a possibility for in the early detection of any diseases. Then seventh point is increased adaptability. The adaptability is more in school children. Whatever we impart, they adapt and they follow that and they are able to transfer to other people. So there is an increased adaptability. That is another need and importance of school health services. And last point is educational opportunity. School itself is an educational institution. It provides an opportunity to render the health conscious or health awareness or health information to the school children. So there are more educational opportunity in the school because school has a conducive environment for learning. So these are the 8 need or importance of school health services. Next is aims of school health services. The ultimate aim of school health services is promotion of health of the school children, protection of the health and the protection from diseases, then maintenance of health of school children and reduction of morbidity and mortality among the school children. Morbidity means the disease rate and mortality means the death rate. Thus, the ultimate aim of school health services is to promote the health of the school children, to protect the health of the school children, maintain the health of the school children and reduction of morbidity and mortality among the school children. Next is about the objective of school health services. There are 6 important objectives. First one is promotion of positive health of school children. Second is prevention of diseases, infectious or communicable diseases. Then third one is early diagnosis, treatment and follow-up of any defects in the school children. Fourth objective is awakening health conscious among the school children through health education. Fifth objective is provision of healthful environment, safe and healthy environment to the school children, conducive environment and healthful environment. Then sixth objective is make co-curricular and extracurricular activities more constructive and productive. That is, make constructive and productive use of co-curricular and extracurricular activities in the school. So promotion of positive health, prevention of infectious diseases, early diagnosis, treatment and follow-up services, awakening health consciousness, provision of healthful environment for the school children and make constructive and productive use of co-curricular and extracurricular activities in the school. These are the 6 objectives of school health services. Well, next is the principles of school health services. There are 7 important principles as to be followed when we render school health services. First one is school health services should be based on the need of the school children. Second one is it should be well planned in advance, planned in coordination with the school personnel, parents and community people. Third principle is school health services should be the part of the normal community health services or basic community health services. The fourth principle is emphasize on prevention of infectious diseases and promotion of positive health of the school children. The fifth principle is school health services also emphasize on learning through active participation of the school children. The sixth principle is school health services should be ongoing process. It should be continuous program. It should be periodically conducted. So it should be ongoing and continuous program. Then last seventh principle is there should be an effective system of maintaining, recording and reporting of all school health services. Each school children should have a separate school health record and that has to be effectively maintained. So these are the 7 principles of school health services. Then next is the health problems in school children. The most important 9 health problems in school children are: first one is malnutrition. Second one is GI problems, gastrointestinal problems. Third one is skin diseases. Fourth one is eye diseases. Fifth one is ear discharge. Sixth one is respiratory related problems. Seventh one is dental problems. Eighth one is communicable or infectious diseases. And last one is behavioral problems, or ninth one is behavioral problems. So let us discuss in detail about the health problems in school children. The first problem is related to malnutrition. Anemia, protein energy malnutrition or caloric energy malnutrition and vitamin deficiency, etc. are common in school children. The second common problem in school children are gastrointestinal or GI problems. That is intestinal parasites, diarrheal diseases, constipation, etc. are common in school children. The third problem is skin related problems like scabies, lice, dermatitis, pigmentation, etc. are common in school children. The fourth problem is related to eyes, eye diseases, refracting defects, squint, conjunctivitis, dryness of the eyes, etc. are the common eye related problems in school children. Next is ear discharge. Ear discharge is very common in school children because they are having the habit of putting some materials like pencils into their ears. So the ear discharge also common in school children. Then sixth problem is respiratory problems or respiratory problems like TB, tuberculosis, pneumonia, acute respiratory infections, that is ARI, and even asthma are common in school children. Next is dental problems. Dental caries are most common in school children and moreover they may have bleeding gums, halitosis or bad breath, etc. So the dental problems includes dental caries, bleeding gums, halitosis, etc. Then communicable or infectious diseases problems are common in this age. The school children are very prone to get a common infectious or communicable diseases in this age group, such as measles, mumps, diphtheria, pertussis, etc. are common in school children. The last common problem is behavioral problems. That includes mainly antisocial behavior problems, habit disorders and personality disorders. Antisocial includes stealing, lying, destructive behavior, that is destructiveness, etc. Then habit disorders includes nail biting, bedwetting, etc. And personality disorders such as temper tantrum, shyness, jealousy, daydreaming, even social isolation or separation. So these are the behavioral related problems. So these are the 9 common problems in school children. The important session of school health program or school health services is the components, aspects, elements of school health services. This will be discussed in detail in the next video, the part 2 of the school health services. Let us just see what are the components or aspects or elements of school health services or school health program. In general, there are 12 different aspects of school health services or components of school health services such as health appraisal or health monitoring, remedial measures and follow-up therapeutic services, prevention of infectious or communicable diseases, healthful school environment, nutritional services, first aid and emergency services or care, mental health, dental health, eye health, health education, education for the handicapped children and school health, maintenance of school health records. So these are the 12 important aspects of school health services: health appraisal, remedial measures and follow-up, prevention of communicable diseases, healthful school environment, nutritional services, first aid and emergency care, mental health, dental health, eye health, health education, education of handicapped and school health records, maintenance of school health records. Broadly, the components or aspects or elements of school health services can be classified into 4 important areas. They are health promotive and protective services, therapeutic services, then rehabilitative services, and last one is school health record. So the elements of school health services or school health program broadly can be classified into for different areas like health promotive and protective services, therapeutic services, rehabilitative services, and maintenance of the school health record. So this will be discussed in detail in the next video, School Health Services Part 2, in detail, the components, aspects, and elements of school health services. The next is school health team. School health team comprises school administrators or headmaster, teachers, parents or representatives of parents, students representatives, the community, the local community where the school belongs, the auxiliary health personnel of that area, school health nurse or community health nurse, and the medical officer of the PHC the school belongs. Thus, school health committee includes school HM, teachers, parents, students, community, auxiliary health workers or health personnel, school health nurse or community health nurse, and medical officer. The last session is role and functions of community health nurse in school health services or school health program. There are 12 important functions of school health nurse or community health nurse in rendering school health services or school health program. Their first one is identification of the schools available in our area. Second is preparation of the tentative plan for conducting school health services. Third one is submission of this plan to the authority to get the sanction. Then fourth one is ensure all the supplies. It includes vaccines, drugs, whatever the material required to conduct the school health program. Then fifth one is permission from the authority, head of the institution. Get the permission from the head of the institution to conduct the school health program. Then next is once the school health program is started, the screening of all the school children. Then providing therapeutic services or treatment to the school children based on the problems, and providing school immunization, then health education to impart the health conscious among the school children, then supervision of the midday meals available in the school, then referral services if it is required, and making follow-up services of school health services, and formation of school health committee or updating the school health committee, and last one is maintaining the records of each children, that is school health records. So recording of school health records. These are the 12 important functions of the community health nurse or school health nurse in school health services. Let us discuss in detail. The first function is identification of the schools available in the area. Second one is preparation of a tentative plan to conduct the school health services. Third one is submission of the plan of action to the authority to get the consent and sanction. Then fourth function is ensure the supplies of vaccines and drugs and other materials required for the conduct of the school health services. The fifth function is getting prior permission from the authority or head of the institution, headmaster or administrators of the particular school to conduct the school health services. Then sixth function is screening the children, screening all the school children to detect any abnormality. Then based on that, providing treatment or therapeutic services for the minor ailments of the school children. Then school immunization and health education or health awareness to the school children. The ninth function is supervision of the midday meals available in the school, and making referral services and follow-up services of the school health program, and formation of new school health committee or updating the school health committee. The last function is recording and submission of the school health records, that is maintaining the school health record of each student in the school and submission of the school health records to the concerned authority. So thanks for watching. Hope this video really benefits in your studies. If you feel it is worth and benefit, please like, share and subscribe my channel. Stay tuned with the Angel Health Academy till we meet with the second part of the school health services video. Thank you.